Hi everybody, this is Dr. John Hayes. You're listening to Beating Neuropathy and Chronic Pain here on 95.9 WATD. Tonight I'm here with my wonderful guest, Tim Kaufman. Tim is actually the clinic director at the Long Pond Physical Therapy Center in Pembroke. And Tim, at the top of the hour, we introduced you, we told folks about your clinic, but you have clinics in Plymouth as well as Pembroke now, correct?
Right, we have two clinics. The one in Pembroke is new. It just opened in November. That's on 31 Scoosett Street in Pembroke, 139 there. And we also have a clinic in Plymouth on Long Pond Road. Hence the name Long Pond Physical Therapy.
Right.
That's where we started.
Super.
Down there at Exit 5.
Now, you have done some work with professional athletes, and we're talking at the top of the hour about exercise, about getting people back from deconditioning, back from injuries, and so on and so forth. How does your work as a top-notch physical therapist who's worked with professional athletes carry over to the person who's recovering from surgery, let's say, or dealing with chronic pain or other types of deconditioning things?
Right, right. It's just some good experience to have, you know, all these, be exposed to many different techniques, many different skills to be able to use in various situations. So not every person is going to be the same who walks through the door, and we all have the same goals, and we all want to get to the same end point. But sometimes we have to use different methods depending on your situation, depending on what your injury is, or what your condition is, what your abilities are. So to be able to have, you know, a lot of different skills to use to meet those goals, I think that's where the trainings come in to play.
Right, for sure. You know, one of the things that I've always admired in the professional athletes that I've worked with too in my career is that, I mean, they have an attitude about their health and about their fitness that I think really carries over greatly for patients. I mean, they view themselves differently, they view their life differently. I mean, they really paint their picture of health is like right here because everything they do in their whole life revolves around that. But I think there's some good takeaways there for patients. So what would you say about that? Because I'm sure you've got some feelings on that too.
Yeah, it was definitely interesting to be part of that when we were working with professional athletes, because it's their job. It's they have to be there. They were in therapy 2 times a day, 6 days a week. Right. And they came down to Alabama to this facility from all over the state, all over the country, you know, and so to be committed that much to the recovery of a maybe just it was a muscle pull or an ankle sprain or something, it really tells you how serious they are about it.
Right, but you know what I find very interesting is the self-care. For example, oftentimes I'll have like a weekend warrior come in. Now let's take an example of somebody who plays softball on the weekend and herniates a disc, and they want to know, how do I treat this, what do I do, and so on and so forth. I say, well, if you really want to treat yourself like the pros do, you will be putting yourself through some type of rehabilitation 2 or 3 times a day. Yeah, exactly. And I think that, you know, we can convey that message to people. It does make a difference.
Right, and then more commonly in the setting where I'm at, I'll see someone a couple of days a week, but we'll give them a home exercise program, and that's a key part of it that is something that accelerates your recovery.
Right, yeah, I mean, what we call the co-treatment plans at home can be very, very powerful. Not only, of course, for getting back into shape, but also, I mean, dealing with chronic pain and getting off medication.
Yep.
You know, for sure, or at least reducing medication.
Yeah, definitely. I mean, exercise has amazing effects on the body, and it can definitely help with things like chronic pain.
Yeah, so let's move on a little bit and talk a little bit more about that. Now, let's talk about what some of the experts consider to be weekly goals and daily goals. Now, I know you're probably familiar with this too. A while back, the American College of Physical Medicine came out with a guideline for exercise. This is going way back, where they basically came out and said that most adults should be exercising a minimum of 30 minutes a day, every day of the week. Right. And there was an uproar over that. I mean, people in this country just went nuts and said, I can't possibly, crazy. And so they got a little politically correct on us, and they toned it down, and I call it dumbed it down a little bit. But let's talk about what the reality is for quantity of exercise, how often, and so on and so forth for most people.
Yeah, there are some recommendations and numbers out there. The National Institute of Health, I think, came up with 2.5 hours of moderate aerobic activity in a week. So
Mm-hmm.
if you do 30 minutes, that's going to come up to like 5
Right.
days of 30-minute aerobic activity. So that can be just walking, that can be biking, that can be hiking, whatever you want to make it, whatever is appropriate for your ability level.
Right.
And that's also a goal. It's not necessarily what you have to do right now. If you can only go up for a 5-minute walk 5 days a week right now, that's a place to start.
Exactly.
There's another side of it, just beyond aerobic activity, you should be doing some strengthening.
Right.
And they recommend just 2 days a week of that. So a separate sort of thing where you're working on some exercises to strengthen your muscles.
Right, and there's your 7 days a week right there.
Right.
So, I mean, I tell my pain patients all the time, at least 5 days a week should be doing something that's aerobic. And I'm sure you tell patients the same thing, that if they have limitations on their time, there's nothing that says that they can't do 5 minutes 3 or 4 times a day.
Exactly.
Don't have to be limited to just 5 minutes a day.
Exactly. Do what you can. Do what you can fit into your schedule. Do what your ability levels are, and the more you move, you'll start to see the benefits over time, and it'll become easier.
Right, and this is really one of the biggest benefits for patients seeing professionals like yourself. Right, you can guide them through this whole process. And
right. Yeah, we do see patients who are just coming in for deconditioning. Say they came out of a hospital stay for something totally unrelated, but they're deconditioned, so they need some guided, supervised exercise to get them back, and we have to adjust what they do, and we can get them on a program for that. But it's amazing. Just a hospital stay for pneumonia or something can wipe out a person in terms of their energy, and they need to work at recovery.
Right. Yeah. So now we talked about the concept of continuing to exercise as we age and mature. You and I have both seen in our practices patients at both ends of the age spectrum, very young, very old. Let's contrast, if you will, some of the habits of those patients who are, let's say, older and significantly more fit.
Well, they tend to enjoy being out active and moving around. They have a routine of stretching or a routine of a walking program, and it's just part of their daily life, and they enjoy doing it, and it's automatic for them, and they end up seeing the benefits of it, and they stay healthier, they stay more flexible, they stay better cardiovascular health, avoiding all sorts of other complications, better immune system really as well with exercise. On the other end of the spectrum, less activity, you have all those negative side effects where poor cardiovascular health, poor blood flow to the extremities, poor stamina, endurance, decreased immune system function.
Right. And all those things, of course, lead to nothing good.
Yeah, there's a whole laundry list of different problems when those things happen.
Exactly. All right. Well, Tim, this is great. When we come back from the next break, we're going to continue to talk to Tim Kaufman. We're going to talk about the role that maintaining muscle mass has to do with your health and beating neuropathy and chronic pain. You're listening to 95.9 WATD. This is Dr. John Hayes. We'll be back in a moment.